Good afternoon, everyone. It's Dr. Gerald here, the founder of Indoor Health. So, as you know, at Indoor, we're passionate about empowering men to make choices that is going to improve their health and to equip them with knowledge and skills that's going to impact their health positively. So, this afternoon, I just want to chat to you briefly about prostate cancer. I believe prostate cancer is a subject that each and every man should be very well aware of and should know quite a lot about. Prostate cancer is a very, very common disease that affects men. About 1 in 4 men have got a lifetime risk of developing prostate cancer. That is quite high. So 25% of men at any one point in their lives are going to develop prostate cancer. So it is extremely important for men to know about prostate cancer and to understand what is prostate cancer and what are the steps that they can take to reduce their chances of getting this disease or suffering from prostate cancer. So prostate cancer, so the prostate gland is a gland that is located just underneath your bladder. It's only found in men, and the function of the prostate gland is that it produces fluid that helps to nourish sperm when sperm is going to be ejaculated out. So it's a sexual reproductive function. So the gland is important for that aspect. So prostate cancer, who gets prostate cancer? As I've said, it's a disease that affects men. And unfortunately, there is a disproportionate risk of prostate cancer affecting black men compared to other races. So men who are black or of black descent have got an increased risk of developing prostate cancer, about 1.7 times compared to men of other uh, ancestry or other races. So it is a subject that particularly black men really need to be aware of, as they are disproportionately affected compared to men of other races. Other risk factors for prostate cancer are your age. So the older you get, the higher the chances you have of developing prostate cancer. So it's important that as we get older as men, we go for prostate checks so that we can try and get early detection of prostate cancer and appropriate treatment before prostate cancer may become either life-threatening or quality of life impacting. The other risk factors for developing prostate cancer on top of age and your ancestry is those who've got a family history of prostate cancer. So in your family, whether it be father, grandfather, uncles who've had prostate cancer before you, or even siblings, your risk for prostate cancer increases. So it's very important that we know our family histories. And then obesity, men who are obese have got higher risk of developing prostate cancer. And there are some dietary related risk factors for developing prostate cancer. However, as I've mentioned, the main risk factors are your age and also your family history and your ancestry, which all those three risk factors you're unable to modify or change. So, prostate cancer, what are the signs of prostate cancer? How can one know that they're at risk or perhaps they're having signs of prostate cancer? So, majority of prostate cancers are actually asymptomatic, and it's for most people, prostate cancer only starts showing symptoms in later ages or in later stages of the disease. So, if you do not have any symptoms, it does not mean you're not at risk or you perhaps do not have underlying prostate cancer that you are not aware of. So that is a very, very important note. And I think the importance of that, it shows us the importance of men going for screening, because prostate cancer has got a long asymptomatic phase of the disease where you are feeling well and you do not have any symptoms. So it is extremely important that we do go for health checks. Some of the symptoms that may develop with prostate cancer, so these may be urinary related symptoms, so there may be changes to your stream or the ease at which you pass urine. Some men may have other symptoms such as loss of weight. Some men may present with back pain. Some men may present with swelling in the feet. So these are some of the symptoms that can happen. Some may be just generally not feeling well, or some may even suffer from erectile dysfunction. But as I've mentioned, majority of men in early stage disease are asymptomatic. So it is important that we catch those men who are in the asymptomatic phase, so that we can treat it appropriately before it starts causing limitations to their health. So how do we detect prostate cancer? So with prostate cancer, we advocate that men undergo screening. So screening basically is for individuals who are asymptomatic, who are feeling well, to go for regular checkups. And these checkups, there's two main checkups that men need to do. The first one is a physical examination where your health provider or your doctor will examine you. And in that physical examination, what is included is a digital rectal examination. Sounds like a big word, but basically what that means is that the doctor who is treating you needs to examine your prostate by inserting their finger, usually the index finger, um, through your anus so as to feel the prostate gland and feeling the prostate gland for any nodules. I know it's a little bit intimidating. It's not a test many men look forward to having, but unfortunately, that is one of the ways that helps us to detect prostate cancer. So the digital rectal examination is important, as it can tell us whether there is prostate disease, and it also gives us an indication on how extensive the disease is there if present. The second test, which is a more friendlier test, is a screening test called a PSA. PSA stands for prostate specific antigen. And this test essentially is a blood test that picks up a specific enzyme that is produced by a prostate gland. And depending on the level of your enzyme, that can make us to suspect whether one has prostate cancer or not. There are different values for different men of different ages, but essentially it is a screening test that raises our suspicion for us to know whether or not there is prostate cancer present. So then, depending on the findings of these two investigations, if the suspicion is high enough, then a man needs to undergo a diagnostic test, which is a more test that tells us with certainty whether prostate cancer is present, and that diagnostic test is a prostate biopsy. And that involves a needle going into the prostate gland, and small pieces of tissue or small cores of tissue are taken and they're sent to the laboratory for assessment. And the laboratory result will tell us whether or not prostate cancer is present. So that is how we diagnose prostate cancer. So it's very important, as I've mentioned, that prostate cancer is detected early. One of the reasons why I would like to detect prostate cancer early is that not all patients that suffer from prostate cancer need to get treatment for their prostate cancer. So early stage of prostate cancer can be treated by surveillance. So what does surveillance mean? Surveillance means you've got prostate cancer that has been detected. However, you've got low risk disease or very low risk disease. And this affords us the opportunity to watch you from time to time through regular follow-up with your doctor or urologist, following up your PSA levels, following you up with rectal examinations, and or other special investigations or imaging that will help us to look at the prostate gland to monitor for any progression of disease or upstaging of clinical disease. So this is very, very important. Why is surveillance important? Because some of the treatments of prostate cancer do have side effects and may impact on sexual function. So you do get a significant number of men, when they get diagnosed with prostate cancer and are being told the different options for treatment, a big concern about them is preserving their sexual function. And it is something that is extremely, extremely important that we do prioritize. However, that small risk of deterioration in sexual function following uh, different treatment options is the main reason why active surveillance is an important entity. So active surveillance is for patients with low risk disease who do not need treatment at that point in time, and treatment may be delayed for when the symptoms or when the disease clinically progresses and becomes um, more higher risk disease. Other treatment options apart from surveillance may include surgery, and surgery is when the entire prostate glands and some of the lymph glands around the prostate in the pelvis are removed. What is called a radical prostatectomy. It is a curative procedure to remove all the prostate cancer, but this is reserved for clinically localized disease. So it's just disease localized only to your prostate gland. There are other treatment options that include radiation. So radiation may be external radiation or implantation of small little seeds that are radioactive into the prostate to burn or to kill all the prostate cancer cells within the prostate. As I've mentioned, each and every treatment has its own side effects that you need to discuss with your treating neurologist. However, these are the options that are available. Some patients may need to be put on some medications to just control the activity of their prostate cancer, um, maybe as a bridging therapy whilst awaiting definitive treatment. And and for those patients that perhaps maybe were detected at advanced stage with metastatic disease or evidence of disease having spread from the prostate gland, there are other options that can be looked at in terms of controlling that prostate cancer. So prostate cancer is a slow growing um, cancer compared to other cancers, with a long asymptomatic phase for majority of patients. So it's important that we detect prostate cancer extremely early to prevent progression of the disease and perhaps the disease even metastasizing, which means spreading to other organs and therefore um, making it impossible for clinical cure of prostate cancer to be achieved. So that is essentially is the nutshell about prostate cancer that men really need to know about. I think as men we need to start chatting more about prostate cancer, start asking each other as men, have you gone for your checkups? Another important thing that I had not mentioned, so when should a man go for checkups? So the recommendation regarding screening for prostate cancer, if you do not have a family history around about the age of 50, you need to go for regular checkups. So if in a man with no family history of prostate cancer, from age 50, you need to go for your two checks, the PSA, and also the rectal examination or the finger test to be assessed for prostate cancer. In men who've got significant prostate history of prostate cancer in their families, so this is someone who's had a sibling, a parent, um, a grandparent, uncles who've had prostate cancer at a young age being under the age of 60, then if you know someone in your family who's been diagnosed prostate cancer under the age of 60, then you need to be screened at a slightly earlier age, from about age 45, so that if you are at risk of prostate cancer, it may be detected much earlier and be treated more appropriately. So basically, that is about prostate cancer. So please, men, if you do have any questions regarding prostate cancer, please feel free to reach out to us, to comment on this video, ask your questions, and then we can address your concerns and help to explain more around prostate cancer. The goal is to empower each and every single man to be aware of this illness. We want to prevent um, men from suffering from prostate cancer. Prostate cancer is a very curable disease. Majority of patients that are diagnosed with prostate cancer do not die from prostate cancer. They die from other illnesses. They may have cancer, but majority of them do not die from prostate cancer. So when detected early, it can be cured. And for those unfortunately who are detected in later stages, the symptoms of the disease can also be managed to a very great extent. So we encourage men to go for screening. We encourage men to talk about prostate cancer so that they can be checked and that we are all aware and we can be empowered to fight this disease. So I just want to encourage you, if you don't already follow us on our platforms, to follow us at Indota Health. You can find us on Instagram at Indota_wellness. You can find us on Facebook at Indota Health, or find us on YouTube at Indota Health and Wellness. So thank you very much for your time and attention. Till I see you again on our next video. Thank you.